want to welcome Lisa Taylor to Living the Pharm Life today. Lisa is a compounding pharmacist in Evansville, Indiana, and an alumna of the Purdue College of Pharmacy.
Yes, I am.
Thanks so much for being here.
Thanks for having me.
All right, so before we jump into compounding pharmacy, I'd like to learn a little bit more about you. How did you get started in pharmacy?
Well, pharmacy, I think, was always going to be my path. I really liked biology and chemistry in high school. I just really excelled in those. Come from like a medical family. My mom's a pharmacist and several of her brothers and sisters are pharmacists. My dad's a dentist. He really wanted me to go that route, but I was not interested in blood and pus and all the things with nasty teeth. So pharmacy was the next logical choice for me. So yeah, I just went that route and I think it's turned out great.
Yeah, I completely get you with the blood and the pus and everything.
Yeah.
My grandmother was a nurse and I got to see a little bit of, like, I shadowed a nursing before I decided on pharmacy. Not exactly, like, I can handle it. I would just prefer not to.
Yeah, we don't need to get into it every day. No,
exactly,
no, thank you.
exactly. Just a personal preference.
Yeah.
If I can hold off, I'll hold off on that. But it really sounds like your family has a lot of healthcare background.
Yes, yeah.
Did you always know that you wanted to end up at Purdue?
Not necessarily. Well, for pharmacy, obviously, yes, that was the option. My dad and my brother both went to IU. So again, my dad wanted me to go to IU. But that really wasn't in the cards because I chose pharmacy and my mom went to Purdue and her family is all big Purdue people. So we have a little house divided, you know, with my parents and my brother. And yeah, so Purdue just for pharmacy was the option. And I'm close enough to home, but far enough away. And I've just really liked it ever since.
So we know you wanted to go to pharmacy school. You ended up going to Purdue. How did all of that kind of combine for you? Like so many pharmacy options. Why Purdue?
Well, a lot of it family influence, you know, with my mom and then her family. So I wanted to kind of do in-state, you know, could have gone to Butler, but, you know, Purdue just was the logical choice for us, you know, since kind of that family connection along with it. So
yeah, how did Purdue set you up for success?
You know, just a lot of options. You know, I had a really good relationship with my advisor, Mr. George, and then Holly Keckler was in Office of Student Services. And I think, I could be wrong, but I feel like my class was one of the beginnings of the learning communities. So that was a really good resource to kind of make those early connections with other students in pharmacy. Versus, you know, going the first day and being that awkward, like, hi, what do you do? You know, so already kind of having those connections with other students so you can kind of go through it together.
Yeah, I was part of the learning community my freshman year, which for me was really big, being an out-of-state student.
Yes.
I moved here, I didn't know anyone within about a 1,000-mile radius. Especially my first semester was fall 2020.
Oh, so
in
yeah,
the
really
pandemic,
isolated.
Yeah, so in the pandemic, it was really big. And my favorite part about the learning community was all of our exams were online. And so we would all close our doors and we would take our exams and the entire floor would be silent.
That's helpful.
And then as soon as the exam was over, all of the doors would fly open and we still had to stay 6 feet apart. So we're all just in our doorways shouting down the hallway. So what did you guys get for number 4? That was
comparing answers.
Exactly. And that was one of my favorite. I think about that all the time still.
I mean, yeah, we could get close to each other, but yeah, having that immediate camaraderie with people was, very helpful.
Yes, I was a big fan of that, especially, you know, being a new student, pandemic.
Yes.
It made a world of difference.
Especially, you're forced to live with them nearby, so that is helpful, especially in that year for you, for sure.
Exactly, and now as a P3 student, a lot of my friends in the pharmacy program, we talk about, do you remember how awkward we were freshman year and the like going into the communal bathroom? I was a fan of that like face wash you used, but I never knew how to say that to you.
Yeah, kind of breaking those boundaries, but yeah.
Yes, exactly. All right, so we've talked about your entry into Purdue. Now, leaving Purdue, you're a compounding pharmacist. So can you tell me more about compounding pharmacy?
So the fun thing about compounding pharmacy is the variety of like dosage forms we can do for patients, customization again, as far as like pills, topicals, suppositories, eye drops, you know, those kind of things. One aspect of compounding that's different from retail is we don't make copies of commercially available medication. So if it's something you can get, at your standard CVS, Walgreens, that kind of drugstore, we don't necessarily make it. Exception being, if you have an allergy or a sensitivity to something in, the commercial product, then that's something that we would then kind of fill in that gap, so you can still get the prescription, still get that medication without causing more problems. And again, too, like if the dosage form isn't right or the strength isn't right, especially for like pediatric dosages, we're actually helping a couple of kiddos down at home right now that have TB. So, and they're little guys, so we have to help compound those medications, into appropriate dosage forms and strengths so that they can successfully take those TB protocol medications. We do a lot of things, for example, for like veterinary patients, because, different from humans, dogs come in all different sizes. So, can you even, like for humans, you think pediatric doses, based on weight, dogs are similar. So that kind of thing, flavoring things for animals so it's easy to give it to them. Going into other areas of compounding, you can get into dermatology, wound care, hormone replacement. I'm probably not even scratching the surface. But yeah, all about customization and just being able to, get the best therapy versus dosage form, delivery method to the patients. So
yeah, that's huge. My roommate and I have a kitten. He has like chronic health issues, and he gets chicken flavored Benadryl every day.
Yes.
So compounding is very big with him for that.
Yes.
He's still not a fan of it. He kind of like foams up a little bit.
So that's a great example for cats. Something we can make is a cream that you apply to their inner ear, to that skin area. So that way you're not having to force it down their mouth and avoid that foaminess.
Yeah, he hates it. He's not a fan, so I gotta look into that.
Yeah, it's great. So many owners really like it. So how did you figure out your interest in the area of pharmacy you wanted to go into?
I feel like Purdue has really helped me a lot with that. I know I came into it kind of in a unique way where I had already seen nuclear. I applied to Purdue and decided to come here for the nuclear program. So I was already really interested in that, but there's been a lot of clubs, especially in my pre-pharmacy years.
Yeah.
I was part of the pre-pharmacy club, and they would bring in different guest speakers to different meetings, which I thought was incredible. I learned so much just from those speakers.
Just getting that exposure for sure.
Exactly. And so that was really great. Especially, I feel like they brought in a lot of more niche speakers.
Yeah.
Which really, I know, because Dr. Weatherman, she gave a presentation to the pre-pharmacy club. We had Dr. Israel, who does pediatrics.
Okay.
She came in and gave a presentation. And it was really like illuminating and inspiring to hear about all of these different things that you can do. So I know that was a big help for me, as well as Purdue offers a lot of electives.
Yes.
I gotta say it again, nuclear.
Yeah.
I've done the nuclear electives, so that's been really great. And then I was also part of the dean runs a course, I think it's the Leadership Innovation Forum, and he brings in guest speakers who have more non-traditional paths.
Yeah.
And so I was part of that course, and that helped me see a lot of other unique things. And so it's just, I really like seeing all the different routes that people can go with a PharmD degree. It makes me really excited to graduate and then find my own path in this field.
And it's nice to hear doing it during your school years and not just having the exposure during your rotation years.
Right.
So kind of getting it earlier, so then, you can kind of customize where you want to take your rotations.
Exactly.
Which, again, I take as many kind of weird rotations as you can.
Oh, I still need to finish plotting my rotations, but I've been looking at that.
Just to kind of be able to get more exposure, and just in case you miss something.
Exactly. But how did you fall in love with this area?
Well, a previous guest you had on here, John Voliva, he is my uncle, and I started working for him. He had opened Hooks, a Hooks Apothecary, the pharmacy, and I worked for him all through pharmacy school. So I just, again, was the logical path for me. I really enjoyed it as far as, the hands-on aspect of actually making the things. You do have a little bit of traditional kind of standard, packaging, and you still have that consulting aspect of it with the patients. So, but the hands-on getting to be creative with things was just really, really what caught me.
Yeah, I do nuclear.
Yes.
I feel like I say that every single podcast, but that's one of my favorite parts is the hands-on aspect.
Right.
So I completely agree with you there.
Yeah, rather than just like the standard pouring and counting, it's getting in there.
Let's see. I feel like you've already talked a little bit about the deeper dive into what customization looks like, especially in terms of my cat. So
Yes.
I'm very, very glad to know that. He's a weird little guy. So
and cats can be really picky for sure.
he is so picky. He's not that picky about a lot of things. He will eat anything. Just he doesn't like the Benadryl.
Right.
We tried giving him normal Benadryl, like normal flavored. Didn't take that.
Right.
My roommate got this custom ordered chicken flavored Benadryl, figuring he loves chicken. His favorite snack is chicken hearts.
Oh, okay. Yeah,
really,
you think. But.
Right. Really weird giving it to him. I've never fed an animal like it looks like a heart.
Yeah.
Yeah. It's really weird. Since getting them, we get a lot of weird snacks around here. It's very odd, especially my roommate's a vegetarian.
Oh, yeah, that would be hard, but you know.
She's the one that buys it.
Say the things we do for our pets.
Yeah, she's the one that buys it. She buys little like freeze-dried chicken hearts.
Well, you have a very spoiled little cat.
We have 2 of them, and they're both extremely, extremely spoiled. Especially she custom got this chicken flavored Benadryl and thought it would be a seller, but it's really not.
Try to go for the top.
I know, but so that's why customization is so important.
Right. Yep. Very important.
Are there any areas of healthcare where you think compounding pharmacy is really like a go-to for physicians?
So just your general practitioners may not be as familiar, but if you get into kind of the specialized areas, like wound care, dermatology, those kind of things where you can really customize the dose, customize what's in it, for the patient. Those would be big areas. Hormone replacement therapy is huge. We do a lot of that as well. Again, just customization, getting those doses dialed in for what the patient needs, giving dosage form options so it's not just a pill they have to take every time. Veterinarian, kind of how we've already discussed in depth of that. So yeah, especially in the kind of the more specialty niche areas, for sure compounding is a critical part, an important part for those providers.
Yeah, fantastic. Thank you so much for sharing. Yeah. Now, for students like me, if they're interested in compounding, what advice would you have for them?
If you can find a compounding pharmacy in your area, if you can shadow just to kind of get a grasp on what they do there. So you can kind of see if that's something that interests you is what the main thing I would suggest. Because I know we do it a little bit of compounding in the pharmacy lab. Nothing like what we do on a day-to-day basis, just because it's a little bit more in-depth and, higher volume of things we're doing. But yeah, shadowing would probably be a big thing if you can find a compounding pharmacy near you to shadow. Taking advantage of if there's a rotation. We take rotation students. So, adding that as one of your options during your rotation years, just to, again, get more in-depth, hands-on experience with it would be a great idea if you're interested in compounding.
All right. Thank you so much. All right. I know you've seen a couple of these episodes, so you may be familiar. At the end of every episode, I like to ask kind of a fun question.
Sure.
So my question for you today is, if you could have any superpower, what would it be and why? So
the first thing that comes to my head is flying, just because I hate road construction. So I know that's not, that's kind of a selfish answer, but just to be able to get places and not have people in my way.
You know what? I completely get you. Driving down 65.
Yes.
I hate it.
Yeah.
I hate it. So I completely understand if you could just go up and around.
Right. Yep.
I like it.
Yep. That's what I'd do.
All right. Well, thank you so much for being here today.
Thank you for having me.
Yeah, I've really liked hearing all about compounding, and I'm sure our audience has enjoyed it too.
Great. Yep. Happy to be here.